Thank you, Chairman. My talk is about spinal schistosomiasis, medical versus surgical treatment. As all of you know, that schistosomiasis affects up to 300 million people worldwide. And there are three known species that cause schistosomiasis, which are Schistosoma mansoni, japonicum, and hematoma. The disease is widely spread in the African countries, Middle East, and Latin America. And it was firstly discovered in Egypt in 1930, while in 1917 it was reported the first case of spinal schistosomiasis in Egypt also. In 1930, it was first reported cases of spinal schistosomiasis due to Schistosoma mansoni. And that's why neuroschistosomiasis is mainly caused by Schistosoma mansoni, which is a granulomatous inflammatory reaction that tends to affect the lower spinal cord. The main clinical presentation of patients with spinal schistosomiasis are either acute or subacute myelopathy, affecting the lower spinal cord and the coda-equina nerve roots. Usually the MRI findings of those patients are in a form of enlargement of the conus, hyperintense T2 signal, and heterogeneous enhancement. In histopathology, you can see the schistosoma ovi surrounded by granulomatous tissue, Gann cells, and polymorphonuclear cells. The management of such cases are either medical or surgical. Medical by giving antischistosomal drug and corticosteroids, and surgery is to be preserved only for refractory cases. In Sudan, we conducted a kind of continuous study since 1995. From 1995 to 2016, we collected 40 cases of spinal schistosomiasis. Most of the patients were young, between the age of 10 to 30 years old. Most of them are males, and most of them were students. Jazeera state is a state in Sudan endemic with the disease. That's why the incidence of such condition is higher in Jazeera state, followed by Khartoum, which is the capital of Sudan. Most of the patients present with the triad of symptoms of bilateral lower extremities, numbness, back pain, and urine retention. The incidence of symptoms usually it's in a form of acute myelopathy between 1 to 7 days, 1 to 4 weeks, most of the patients. And the signs we detected in the patient was mainly in the form of lower extremities, weakness, sensory level, and abnormal gait. Most of the patients were able to walk, but with difficulty, as the power was grade 4 in most of the cases. Sensory level was mainly in the level of D12 because, as I have mentioned before, it's affecting the lower spinal cord. And we investigated the patients with MRI, myelogram, urine analysis, hemogram, and serology for schistosomiasis. MRI finding was mainly in a form of expansion of the coda-equina, and CBC was not significant. Serology was positive in one of the cases. Most of the cases treated medically with praziquantel and steroids, while only 9 patients underwent surgery for unclear preoperative diagnosis. This is the type of surgery mainly was in a form of laminectomy between D11 and 1 with biopsy. Only we are taking biopsy. We don't do invasive procedures for the spine. The complication we encountered in 4 patients in a form of bed sores, muscular atrophy, constipation, diarrhea, joint pain, difficulty in passing urine, recurrent UTI. Most of the patients post-treatment improve in a form either cured or improved. And these are some examples for our cases. 16 years old male presented on wheelchair. This is the MRI. You can see the expansion of the conus with the high signal in T2, heterogeneous enhancement, post-contrast. This is of the surgical patient. The histopathology confirmed the diagnosis of spinal schistosomiasis. And you can see the slide. This is the ova with the peripheral spike of Schistosoma mansoni. Another patient, 25 years old, female, before treatment. This is the MRI expansion of the conus. She was having difficulty moving her lower limbs. You can see.
You have 2 extra minutes.
Okay.
Please resume.
To conclude, spinal schistosomiasis tend to produce characteristic clinical, radiological, and histological features. There is no general agreement between the neurosurgeons and neurologists about the management of this condition, but we recommend the trial of drug treatment and surgery to be preserved for refractory cases. Thank you very much.